My name is Dr. Amir Bigdeli. I am head of the Department of Diagnostic and Interventional Radiology here at Artemed Clinic Munich South. We are one of 18 hospitals of the Artemed Group throughout Germany, and we are a specialized surgical clinic with 200 beds. Our hospital is the largest location of the Munich Fire Department, and we are a certified trauma center. We performed approximately 5,800 CT scans and about 19,000 X-ray examinations last year. I met deepc 3 years ago, and now we are working together closely for 1.5 years. I intended to use artificial intelligence long before I met deepc here in my department, but unfortunately my plan failed. First of all, because of the very strict data security regulations here in Germany, and on the other hand, because of the shortage of IT resources. The greatest benefit for me is the possibility to test the algorithms for about 3 months before buying them. Another one is the easy and simple installation process by deepc. The last point is the perfect service and almost round-the-clock availability for questions or possible problems. We currently use a fracture detection algorithm named Gleamer, which we installed via the deepcOS. This algorithm fits our needs the best. Right at the moment, I am testing an algorithm for analyzing chest X-rays, and soon I will have the possibility to test an algorithm for chest CTs. By using AI, especially fracture detection, we have been able to increase the efficiency of our residents, especially in duty hours, and to speed up the treatment of our patients. Now, there are less doubts which require consultation with the experienced doctor in the background. Also important for us is the valuable feedback that our young residents receive for each X-ray. In my eyes, this is crucial for their training. And in view of the increasing numbers of examinations each year, we benefit from the possibility of faster reporting. As I mentioned earlier, I am now testing an algorithm for analyzing chest X-rays and soon another algorithm for chest CTs. That works almost as easily as installing a new app on your smartphone. All it takes is a short consultation with deepc. Without deepc, I would have to contact the respective providers of the algorithms and then go through it with my IT department for every test. At the end, it would take much more time and consume many resources. It is remarkably simple to integrate new algorithms in our daily workflow. Once the platform is installed, it doesn't even need the input of our IT department anymore. Without deepc, I would have to contact the providers directly each time, which is not always easy. Furthermore, I would have to ask our data protection officer for permission, which takes a certain amount of time. Because of course, she first has to investigate the provider and his service. If she then gives green light, then my IT department comes into play. They have to contact the provider and initiate the connection. Now imagine that the algorithm doesn't pass the test and has to be uninstalled after the test period, then all the effort was in vain and we lost several months. deepc makes the testing and installation of new algorithms so easy and flexible. I am convinced that we will continue to benefit from the collaboration in the future. There is already another large Artemed hospital that had recognized these benefits and adopted deepc. I am very excited about the future.